Did you know that a migraine can be so severe that you can be temporarily paralyzed on one side of your body with no use of an arm, your leg, and trouble speaking? But did you know that avoiding a migraine may be as simple as avoiding red wine? Welcome to my channel. I'm Dr. B. I'm a board-certified, fellowship-trained physician, and I make educational videos. In this video, I will teach you what a migraine is, what happens in your brain when you have one, and watch till the end to learn the simple changes you can make in your daily life to avoid getting a migraine. Learning those simple triggers that you can avoid. A migraine is usually a one-sided throbbing or pulsatile headache located on the side of your head, toward the front or around and surrounding one eye. The pain will build up over 1 to 2 hours and may last up to 3 days or more. Any movement makes it worse, and it is commonly associated with nausea, vomiting, and a severe sensitivity to light known as photophobia. We used to think migraines were only related to blood vessels and the amount of blood flow, and that was known as the vascular theory. In this model, a substance such as brain serotonin was low. This caused brain blood vessels to constrict or get smaller. This would then temporarily decrease blood flow, and then a rebound effect would occur with the vessels getting much larger or vasodilating. The blood flowing through these larger vessels would account for the pounding, pulsatile headache throughout the brain. This theory, however, is no longer accepted, and now migraines are thought to be explained by the very complex neurovascular theory. This means both blood vessels and nerve cells are involved. In the neurovascular theory, those with migraines have baseline brain cells that are very irritable and easily excited. Similar to somebody who has epilepsy, their brain cells are very irritable and prone to being stimulated. Now, in migraine patients, in the rear of the brain, which is known as the occipital cortex, this is where the most susceptible nerve cells live, and MRI studies have supported this finding. These easily excited nerve cells will fire when triggered, and when they do, they release substances known as neurotransmitters. These neurotransmitters are secreted right next to blood vessels in the lining of the brain. This produces inflammation and is interpreted as pain by your body. Now, in addition, these neurotransmitters also will cause dilation of the vessels. This produces additional pain when the blood flow is increased. These complex brain changes resulting in severe pain can have many triggers, and we'll talk about 9 of the most common. Number 1, hormonal changes. 75% of those with migraines are women. Particularly onset of menstrual cycle and ovulation causes fluctuation in hormonal changes, and this can trigger a migraine. Also, there's a strong association with oral contraceptives, which are also hormonally based. Number 2, stress. Occupational, relational, and financial stressors can trigger a migraine. Optimizing your job, marriage, and actively reducing stress with various techniques including biofeedback, yoga, regular exercise, and counseling may all help significantly reduce stress and therefore migraine frequency. Number 3, excessive or insufficient sleep. Irregular sleep schedule and intermittent lack or loss of sleep is strongly associated with migraines. Developing a regular sleep schedule and simple techniques to limit insomnia, like limiting blue screen devices late at night and developing sleep routines, can significantly decrease migraine triggering. Number 4, exposure to brighter fluorescent lighting. Just as some individuals have seizures with blinking lights or strobe lights, some individuals have migraines triggered by light, including bright sunlight, spotlights, or flashing lights, like those seen at concerts. Number 5, strong odors. Although not common, those with migraines can be triggered by strong smells, such as cologne when working in a makeup boutique, or from coworkers or workplaces that have strong smells like seafood restaurants. Number 5, fasting or skipping meals. This common association with migraines is likely from the decrease in blood glucose that occurs when not eating for extended time periods. Therefore, maintaining a regular eating schedule, avoiding fasting, and eating high-protein diets, which gives a steady, more stable blood glucose level, can be helpful in limiting migraines. Number 6, red wine. Alcohol in general, and red wine specifically, is associated with migraines. And interestingly, red wine in women is the most commonly associated with migraines. Therefore, changing your drinking habits can make a marked difference in the frequency of migraines. Number 7, caffeine. For some, caffeine is associated with migraines, and a change in usual caffeine consumption, like missing your daily cup of coffee or drinking too much or more coffee on a certain day, can be a trigger. So moderation and consistency in consumption is recommended. Number 8, Monosodium Glutamate. MSG is common in Chinese restaurants and other food. It is associated with migraines. Now, there has been some research focused on MSG, which has not found convincing evidence of migraine triggering. However, given the common association for some, it may be useful to consider this if you consume MSG on a regular basis. And finally, number 9. Foods containing tyramine or nitrites. This is food like aged cheeses like cheddar, blue cheese, or cured meats like summer sausage, pepperoni, and salami. These have a well-known association with migraine triggering, and simply avoiding them may prevent a migraine. Thanks for watching. If you're interested in learning more about other medical topics, try this video on identifying depression, or this one on things you should never say to your kids. And please don't forget to hit subscribe.